But okay, whew. I was like, this is a big opportunity for me. Thank you for coming on and giving me some of your time and because your freaking busy schedule and whatnot. But I was hoping we go maybe like an hour and stuff, and you just you tell us and whoever wants to listen to this who you are, what you do, type thing.
Okay.
You know what I mean?
Sure.
All right. Cool. All right. So yeah, I guess we'll just jump right into it. You're a registered nurse.
Yeah.
Okay. And how long were you in school for?
So I was at Cuesta for a while. I have so many units at Cuesta, like enough for probably 2 or 3 AAs. I just didn't know what I wanted to do, so I kept taking all kinds of classes. And then I took the nursing assistant class, and I loved it, and I went kind of right into nursing from there. And I did my LVN first, got in the first time around. Because it was a lottery, they didn't care about your grades because my grades were not very good because I didn't have motivation, right? And so it's funny because if you look at my transcripts, I mean, it was fine, but I got, mostly C's and some B's, and then as soon as I started nursing classes, I got really good grades because suddenly I found out something that I like to do, And so I did that. I got in on the lottery system for the LVN, did that. I graduated that, I think, in 2012, so 13 years-ish ago. So that's, I guess, when I was a nurse, and then I went back and 3 years later graduated in 2015, I think, with my registered nurse license. That was in Santa Barbara.
Okay.
But, yeah.
So you're not from Central Coast?
I am. I grew up in Paso.
Are you serious?
Actually, I grew up in San Miguel, but...
Not really. In San Miguel?
Yeah.
What were you doing for fun out there?
Riding horses and playing with animals. I lived in San Miguel, but I lived...
Farmland.
Okay. Yeah. I didn't live, in the town. We were in our own school district, way out in the country.
Okay. And then at some point, were you living in SLO when you were going to Cuesta doing, the nursing assistant stuff?
Yeah.
And so that was, 2010 or something?
Probably.
Okay.
Sounds good.
Nice.
I moved into town, in Paso into town when I was, 16, and then moved up to San Luis probably when I was 18 and started going to Cuesta because I was I don't know what else I'm going to do. And I never took placement tests in high school. I didn't have a plan to go to college, but I graduated high school and I don't like being bored. So I was what am I going to do? I don't know. I guess I'll go to Cuesta because you can just get in, community college. So I went there and I met with somebody to take classes, and they were and I was all right, I guess I'll take English and math. And they were you can't take English and math. You have to take placement tests. And I was okay, and nobody ever told me that. So I took the history of rock and roll and ceramics, and yeah.
Nice.
But I lived in San Luis during that time. San Luis is awesome. The whole Central Coast is awesome.
Yeah. It's a nice place to live.
Yeah.
It's a nice place.
Really
There's a everybody comes here to visit, you know what I mean?
Yeah, right. We live where other people vacation.
Yeah. And at the hospital that I'm at, that you saw me at recently, tons of freaking travelers want to come here.
Yes.
You know what I mean?
Yes. And you guys had so many travelers. It's a nice hospital. It's a nice place to live. Why not?
And honestly, I like the travelers.
Yeah.
You know how sometimes they kind of get a bad rep? They're honestly I'd say 8 out of 10 times they have a bunch of experience, and they're usually in a pretty chill mood because they're oh yeah, just
they're not phased anymore, right?
Yeah.
They've been exposed to so much.
No, I when I need freaking IVs and stuff, most of the people that I go to first are travelers. Yeah. Unless it's this one dude named Spencer is really good. Yeah. But if he's not there, then there's multiple other people.
That's cool.
A bunch of them know how to do ultrasounds and stuff.
Yeah,
so.
They get all kinds of training. It's cool. I was in Georgia working for a while, and then when I moved back to California, I took a travel job in Templeton.
Are you serious?
Yeah.
That's cool.
So that's the only really time that I worked bedside full time as a nurse in the county was as a travel nurse.
Nice.
But it is fun. I like the travelers because they've been to so many places. And, yeah. And then it was from Georgia when I came here as a traveler, I was super nervous And then when I started working, I was like, oh, like California laws, like this is not actually bad at all, because how they treat the nurses, like comparatively, I know there's like room for growth, but comparatively pretty good.
Yeah.
So I think the travelers appreciate that too, the ratios and everything that they get here.
Yeah. So you graduated, you said you were down south in Santa Barbara. You graduated from there in nursing school 2015?
Yeah.
You said, okay. And then I guess give us kind of like what you, like your background and your timeline on what you did after that point, because you went from, you said you were in Georgia for a bit, and then you worked at, definitely when we were your students, you would tell us about working at this other hospital. I don't know if that was in Georgia, and then like you eventually became a nursing instructor.
Yeah.
So like give us
the quick
quick and dirty. Not even quick and dirty.
Okay.
Like give us an explanation. Like
okay.
Yeah, this is an interview.
Okay.
You know?
All right. Let's see. So I started in Santa Barbara, went to the city college there, got my associate degree in nursing, worked on a surgical trauma floor for a few years. Great place to work, great place to start my career.
Were you doing night shift or days?
Night shift for probably about a year and a half, and then day shift for about a year. And then, night shift is like its own beast, right? But I also was working, so I guess I'll back up a tiny bit, because when I was at LVN, I also worked as a nurse in a nursing home. So I worked as a CNA in a nursing home for like 2 years, nursing assistant, and then I went and worked as a nurse in a nursing home, a vocational nurse in this county. And then when I went to Santa Barbara, I actually was going to quit, but that nursing home had a facility at the time in Santa Barbara, so they were able to just transfer me over so I could work as an LVN while I was in nursing school. And so I did that in Santa Barbara County. And then when I got my RN and took a job at the hospital there, I was so scared that I like couldn't cut it, that I didn't quit my vocational my job at the nursing home, because I also really loved working at the nursing home. And so I like worked both jobs for a while, and then finally was like, okay, the hospital is where I want to be now. So I quit my nursing home job, worked at the hospital. After that, I moved to Georgia, worked at a
Why Georgia?
What?
Why Georgia?
My husband got a job there, working. So I got married at that, like right around that time, and right after we got married, we moved there. Knowing it would be a short-term assignment. So we were there for like 2.5 years or so, and got a job at a really great hospital there. Amazing teaching hospital. Really, like, we would get patients from all over the country. We did a lot of clinical trials. I learned a lot in my first 2.5 years of nursing, of course, in Santa Barbara. But then going there, I felt brand new. Like, everything was just wild. Like, the stuff I'd learned about, but we never even saw. And so that was really cool. I learned a lot there. I think I got my bachelor's while I was in Santa Barbara still, and I got my master's somewhere in that transition. I don't remember because it was online. And then after Georgia, we moved back to California. I did a travel job on the Central Coast. And that was really just to have a smoother transition back to California, like not have to try and find a job right away, just like go right into a position, and then figure out where we were going to go from there. So I took that travel job, Central Coast, then moved to San Diego after that travel assignment was done. So that was like a 13-week assignment in California. Went to San Diego, worked in San Diego on a neuro PCU floor, and at Scripps Green, I shouldn't say the hospital name, I don't know.
Oh, you can say whatever you want. Yeah.
But that was a cool job too.
Scripps Green?
Yeah, so it's on Torrey Pines Golf Course.
It's on a golf course?
Yeah, it's on a golf course.
Playing golf?
Yeah, so like on our unit, one whole wall is all windows, like one of the whole walls of patient's room. So you'd be in the patient room, and the whole wall is a giant window, and you can look down and watch people golf. And you can see people windsurfing off the cliffs, and like they had one of the Opens, the U.S. Open, while I was there, and so like all the patients are like they watch Tiger Woods like out their window.
Are you serious? Gnarly.
Yeah.
Okay.
So it was really an interesting place to work. Definitely different than like anywhere else I'd worked. Way like our patient ratios were really good. Like, they didn't put a lot of tax on the nurses, and they ran things a little bit differently in regards to, like, the expectations of what a CNA would do versus what a nurse would do than anywhere I'd ever worked before. So it took some of the work off the nursing staff, and their whole philosophy was kind of like work to the highest level of your degree. So, you know, in some ways it was really cool because it gave us more time, but it also took away from patient care a little bit, in that we weren't responsible for very much like direct patient care. We were more responsible for assessments and meds and things like that. So good and bad, like, it definitely affects the therapeutic relationship that you build with people when you're like, when they're like, I have to go to the bathroom, and you're like, okay, I'll get somebody else to help you, you know,
Yeah.
like, to not just be able to respond and help them when they need help.
The crazy thing about the, like, helping someone in the bathroom is, like, you'll be busy and then you'll have to do it, and then you'll lose a chunk of time,
Yeah.
which can be kind of nervous sometimes, like when
Yeah.
you're already behind.
Yeah, totally.
But it is nice having someone help with the bathroom.
Yeah, it is nice. It is nice. But then also, sometimes you take them to the bathroom and you get, like, really good assessment and information you wouldn't normally get.
If their
'cause
oxygen drops.
Yeah, or like they become more comfortable with you, so they disclose something that hadn't been disclosed that, like, is pivotal in their care.
Yeah.
And so it's like, it seems like a meaningless task, but sometimes it actually is really important. Right?
That's a really good way to look at it.
And so, yeah, so it's like, so it's interesting. So it was a weird balance, because I feel like sometimes the patients think, like, oh, you're too good to help me with that. And it's like, no, they actually don't. They, like, want us to separate that, which in this county, sometimes you don't even have CNAs. So the nurses are doing everything. So there's good and bad, right? Like, it might disrupt the therapeutic relationship with your patients if you didn't do those things, but doing those things, it's going to take away from the nursing, like the true nursing skills that you might need to do, like assessment things and stuff like that. So I don't know. There's a balance for sure. But so that was an interesting job. While I was there, COVID hit. I was pregnant, and CDC said, if you remember, you don't have to wear, I don't know how it was in this county, but they told us that we didn't have to wear N95s with our COVID patients anymore. We could just wear a simple mask. And I was pregnant, and I was like, oh my gosh, that's awesome. So a simple mask is going to protect us against COVID-19. And they're like, no, it's not. But you can still just wear it. And I was like, well, you know, there's so many unknowns. And, like, we know a lot more now, right? That would maybe change my attitude at the time. But at the time, it was just really scary. And I was pregnant, and so I didn't want to work. And we were pretty low census because we did a lot of, like, back surgeries and stuff that were, like, planned. So we stopped doing planned surgery, so our census was real low, so we could get flexed off. And so I requested to get flexed off because I didn't want to take care of a COVID positive patient while I was pregnant with only a simple mask. And the first day that I was flexed off, I got a phone call from my manager, and she was like, because she knew how I felt, and they were trying to be super nice about it, because, you know, and she asked me, and so by this time I did have my master's. So she asked me if I wanted to be a part of a COVID call center, triage call center. So this hospital had a big triage call center already, where patients could call in. They get triaged based on a triage system, and then they're told what to do, basically. There's a little bit of medical information they'll give them over the phone, but usually they'll tell them you need to make an appointment with your doctor, or you need to go to urgent care right now, or you need to go to the hospital, or you need to call 911. Like, what is safe for you based on your symptoms? And so they opened up, like, a little cubicle space for COVID, and they staffed it with hospital nurses that were being flexed off. And so I was like, yeah, I'll go there. So I was working triage phone lines, which is something I never, ever expected to work in a cubicle, right? And so I had my own little cubicle space, which because they had to keep us all social distanced, and a headset, and I answered phones all day. And it was before the 211 San Diego County had their own, like, line set up, so they didn't. So we had calls, and we had people waiting to talk to us on our lines for like 2.5 hours backlogged from the moment I sat down to, like, so it was just one call after.
Health questions,
fear. So many people were so afraid, and it was wild. And finally it did slow down a little bit when the 211 in the county opened their own call center, so that was cool. But I mean, we would come into work and like the answers to the questions from the day before would be completely different because the CDC would be giving us new information every day. So everybody was getting super frustrated with it. And so it was like, it was a really interesting job to see triage, like online or like phone triage, which I'd never seen or thought of, like didn't realize that's like truly nursing. Like everybody that worked there full time are nurses, right? And so it was kind of interesting. But so we did that, and then once we didn't become as needed because COVID was kind of a little bit more contained and there wasn't quite as much fear, and the county had lines open for different things, then we cut back a lot of the nurses. So we had, I don't even remember, but probably something like 50 nurses, like all the time answering phones with a 2-hour long wait list. And then we cut everybody back, and they invited a few of us to continue something called the COVID Care Companion. And so I was really lucky, and that's why I say everybody should get their education, because I never thought I was going to be in a phone center. But if I didn't have my master's, I would have been invited to do the COVID Care Companion. And for me to do the COVID Care Companion was so important because I was not ready to go back to bedside because I was still pregnant. COVID was still there. We had a huge shortage of PPE in San Diego County. So I could go back to the hospital unprotected, or I could continue working in a cubicle throughout my pregnancy and be a COVID Care Companion nurse. So we did that, and it was cool, and it was a group of maybe like 6 or 8 of us, I can't remember, and they got some IT people from the hospital and designed this app for home monitoring of COVID symptoms. And then every patient that came through the hospital with COVID, we followed them after the hospital through this app. They didn't have to, they could opt out, but if they wanted to, we taught them how to like check their vital signs and their symptoms, and every day they would go on their app and click in their symptoms through this checkbox. And then every morning when we came in, we would review everybody's symptoms that they had sent in, and we would call them if there was concerns, and we would just basically monitor them that way. And then for people who hadn't filled out the app in a day, we would call to do check-ins on them. And it was pretty cool because we did a few times have to send ambulances to people's houses who didn't fill and didn't answer their phone. And they were patients that were like found down by the ambulance that they wouldn't have even been notified that there was an issue had we not been following them. So it was pretty cool. Like it was a really cool, like.
How do you know they were down?
But just because we couldn't get a hold of them. So we expected, we expected that they fill out their, because they agreed to it when they want to be a part of the program. So they needed to fill out their symptomology every day. And then once they got better, we would put them on like an every other day plan. But if they weren't filling it out and they're supposed to be on an everyday plan, we would call them. And if we couldn't get a hold of them after 3 phone calls, then we would call for a wellness check. And so they would go check on them. And we had some that were living in hotels, like COVID. If you remember that some of the hotels were COVID sanctuary hotels. So they would send patients there to isolate in the rooms that had COVID, and they would send a nurse to the hotel to check on those patients in the individual rooms. And so some of the places, if our patients, if they were like not responding, we could send the nurse to their room. But the ones that were living at home, we just had to do wellness checks on them. It was pretty crazy. But remember, COVID was really serious, and everybody was so scared that most of our patients were super compliant. And the ones who didn't want to be any part of that, it was totally voluntary. Like, it was no problem. We'd be like, do you want to be a part of COVID Care Companion? And some would be like, no way, I'm fine. Yeah. Okay, cool. And other ones were fine, and they still wanted to do it because they were so scared. And so it was like, those ones that wanted to do it were usually really diligent about doing the self-assessment.
You're giving me flashbacks right now.
It's weird. Like it's weird stuff that was going on, yeah. Especially knowing, like, now what we know, right? But we didn't know what it was going to turn into. Yeah. And so, kind of interesting. So I did that, and then after that, I came back. I came back, and I started teaching at Cuesta.
How'd that happen?
So I like teaching. I always liked teaching, but
You're good at teaching.
Nice.
You were like, I would say, like you were one of everybody's favorite teachers, 1,000%.
I don't know about that, but thanks. Yeah, I always like
you were
teaching.
nice, and you still are nice.
Thanks.
Yeah,
I mean, I
yeah,
try
yeah.
to be nice most of the time, because if I'm not nice, I don't like feel good about it.
Yeah.
But yeah, so I don't know. I always like teaching. I had a horrible fear of public speaking.
Are you serious?
Yeah, when I was in high school, like I would throw up every time I had a presentation.
Yeah.
One of the classes I took at Cuesta early on was public speaking, because I thought, oh, it'll help me get over my fear. But it didn't. It just made me like feel sick every time I had to do a presentation. But nursing helped me. That changed my whole, because you're talking so much to families. Like I used to I'd be so nervous to even like when you go to a restaurant and everybody's like sitting down and you have to like walk to your table, and I would be like so awkward. Like I don't like to walk in front of everybody that's sitting down.
Definitely.
It's like just some weird. I think it's because I grew up in the country. You know, I was like
You're used
a country
to being
kid
on horseback.
Yeah, not a bunch of people around, and so but nursing, I think just I'm good one-on-one or with small groups of people, and like with nursing, that's where you are, right? And then slowly you bring more family in, and slowly you're actually doing teaching. And so I realized, like, okay, talking in front of a bunch of people is pretty much the same as talking in front of 3 people. It's just, people don't talk back as much, but it's like it's the same thing. And so that helped. And then when I was working in Georgia, I did some staff education. And they had a dedicated educator for that unit, because it's a huge hospital, big unit we worked on. And so she helped me with some stuff, and I got to do some like competency fairs for staff and staff training. So I really loved all that. And then I just wanted to go into education really badly, and I wanted experience before I did it too, right? So I don't know. So then it just felt right, because at that point I had my daughter. I think she was probably like 6 months old or so when I started teaching. And I started in the CNA program, covering for the lady who had taught that program. It had been closed for 2 years when I taught it. The lady who taught it before me actually was my CNA teacher, and she'd taught it for like 40 years or more. So she was really sweet and encouraging, and so I taught that. And then the director at the time at Cuesta was just really a good advocate for me, and encouraged me to get into the RN program, and a spot opened up, and I kind of went for it. And so I was really glad I started the CNA, because that material is so second nature at this point, and the RN program's not, right? Because like even my class, like even though I'm teaching it, I have to still review some of the information, because that deep pathophys, you don't use it regularly, right? So, and not only that, but like a lot of the stuff changes. So a lot of it's changed from 10 years ago when I learned it, or 12 years ago when I learned it, and so it's like I'm a student and an instructor all over again.
Yeah.
And so, yeah. But then around that time, during COVID, because when my daughter was 3 months old, I graduated with my doctorate. So I did that.
How'd you get that?
How? When did I start?
Where'd you get your master's from?
Online. Western
Online.
Governors, yeah.
Okay.
And then...
And you got your bachelor's in person in Santa Barbara?
No. I got both my bachelor's and my master's online.
Okay.
And I was like moving around. And then I got my doctorate through Fresno State.
Online?
It was like a hybrid program.
Okay.
But it actually ended up being more online because it was during COVID. So we go to campus for like intensives and things like that. And so I think I went to campus twice, and then COVID hit, and so then they were like, you can't come anymore. And so even my dissertation and everything was online. So that was kind of cool as a person who wasn't yet totally used to public speaking. Now I'm much more used to it, but sometimes I'm still nervous.
What even is a doctorate?
It's like, what do you mean?
Like, what is a doctorate mean? Like,
it's just more education.
I know a master's, and honestly, like, I know nothing really about education or anything. I'm surprised I'm made it this far, honestly.
No, you got into Cuesta's program. And I tell all my students, I never would have made it in there. I didn't have the grades for it. I didn't have the drive early enough to make it. Like, I wouldn't have ever made it into Questa's RN program because of how rigorous it is. I lucked out because I got into the lottery program, and then I went to Santa Barbara on a wait list. So I actually didn't get into nursing school at all of my own volition, like of my own success. I just got really lucky, and then I did well because it's what I wanted, but I didn't have the drive from the beginning. Like, I wouldn't have been able to get it in there the way you did. So don't discredit yourself. You have worked really hard to get where you are.
I knew I had to change something in my life, and I was like, all right, like I need to get more serious about school.
Yeah.
And then that's kind of what led to, okay, freaking, because I used to not, like, my studying would, like, I would prioritize everything else in life, and school would be the bottom. Like I enjoyed my playtime and my living and stuff, and then I was like, all right, like I need to focus on school a little bit so I can get decent grades and go do something I want to do.
Yeah.
But it definitely took years for that to click in my brain. I think I was at Questa like 6 years total.
Yeah.
Like I was at Questa for a while. The second half of my journey there was in the program with you guys, but it took a while to like
get
going and take college seriously for sure.
But
for
you
sure.
did, and and you're young, and it's really cool. I mean, I don't remember exactly the demographic of your class, but it's hugely different nursing school than like the general college classes, right? Like, there's much more diversity, and
there's like adults in the program.
I mean, everybody's an adult once.
Yeah,
but I know what you mean. There's like real grown-ups.
There's real grown-ups with kids, and they're also working full-time.
Yeah,
and
there's a lot of people that are like second and third career. And so it's like they come in with a lot of different kinds of experience, and it's really interesting.
When back to the doctorate, so I know a master's is it seems like a master's is in the same boat speaking as a bachelor's degree. Like, it's some extra school and you get like a more notable title, and I guess you can teach with a master's degree. What the heck is a doctorate's degree? Like I know a master's, you can get it like in a year or two. Mm-hmm. After you get a bachelor's, what even is a doctorate degree?
Yeah. So I mean, it's similar in that it's just like continued education. You definitely are more directed in a bachelor's program. In a master's program, you have a little more leniency in your learning, but you're still pretty directed. And then in a doctoral program, you have much less direction, much more leniency, wherein you can kind of direct your education. You can pick your focus on what you really want to work with. You still go through structured classes. Like, I had an epidemiology class, and we had a statistics class and things like that. And so the depth of knowledge is much deeper, at least from the master's program that I went to. I don't know that I got a huge amount out of it, just because, like I think you are, I naturally want to learn, so I'm naturally already like a student even outside of school, and I feel like you're the same way. And so being a student in a master's program, I learned a little more, but it's not like, had I not been in that program, I still would have been learning stuff on my own. I don't know if that makes sense. So it's like I gained a little bit from it, but it didn't like blow my mind, if that makes sense.
Yeah.
But you do these things because it opens opportunities for you, and maybe a master's degree in other areas gives more. But for nursing, it doesn't. You're not learning really a whole lot about bedside stuff or disease processes. It's much more like, my master's was in nursing education, so I learned a little bit about curriculum stuff, but a lot of it about research papers and things like that, which I had a pretty good grasp on already. So I don't know, not to discount it, but it just wasn't like a lot of brand new information that wowed me, if that makes sense. Where the doctoral program, I felt like I did grow a lot more. So mine was in education and had a focus on curriculum development. And so, you do a lot of hours, like a lot of practical hours, but they partner you. You have a mentor from the program. My program was like a new group where Fresno State and San Jose State had always had a combined program. And then my class was the first class where they separated programs. And so we were like the trial class for Fresno State. So there's only, I think, 10 people in our class. So we basically had like a faculty member for each student. So like I was really like mentored heavily through my doctoral program. And
what were they telling you? What were they teaching you? Mentoring you?
Yeah, like different stuff. So like the epidemiology stuff for me, I thought was really interesting because then it ended up happening with COVID too, right? But it was really cool to like learn what epidemiologists do, follow disease processes, how to like basically they would track these different like epidemics or pandemics or whatever is going on in populations and figure out what caused it and how to prevent it. And things like a salmonella outbreak, right? And so they're like, oh, we're going to kill all the chickens. Well, that's like it's just not very reasonable solution for a population of people that rely on their chickens for food, and, you know, to basically make a living. And so instead you would say like, okay, let's start testing the eggs. How many of these chickens have salmonella? Well, it turns out that like a lot of the chickens have it, but how the eggs are being contaminated is through cracking unwashed eggs, and it's actually on the external shell, not on the internal egg. So then they find these solutions, and then they do education for the populations and say, okay, if you don't want to kill your chickens because you need them to live, then instead you can just put the eggs through this egg washing process before you crack them, so you don't transfer salmonella from the outside of the egg into the actual egg yolk. So it's just kind of cool, like just a totally different way to do nursing, to monitor populations and that kind of thing. And then, you know, you do learn a lot about like the history of different people who have made big impacts on education and how to teach and different philosophies of teaching and things like that. So, I mean, I think I did learn a lot with that kind of thing as well. And kind of what kind of assessments you can do, especially specific to nursing school, because it's not at all the same, right? Like as any other kind of teaching, like there's so much importance to use hands-on and case studies and things like that, and not just do death by PowerPoint. Like we still have it, right? We still have to do a lot of PowerPoint just because it's hard to get all the information out there that we have to get out there. But then we try to partner that with clinical and lab and things that, and case study projects and things that will hopefully work your brain in a different way.
PowerPoints aren't bad. It's more just the presentation of the actual PowerPoint.
Yeah.
So like, is someone then be reading from the freaking slides, or is it just more like shorter, concise PowerPoints with like an image or something, and then that person's just like sees it pops up, and the teacher elaborates and kind of almost kind of like it when there's like a story and personal experience. So then the audience can be like, okay.
And you remember it better, right?
You
like if it
better,
was actually tied to some story instead of just like memorize the side effects of your beta blockers.
Because sometimes it's like, oh, here's I remember like sometimes learning about the medication, there's just 20 on the screen, and it's like I don't even know where to start.
Yeah, totally. Yeah, and it's flashcards, and there is some of that you have to do, right? But like if you're talking about a side effect for a medication and I just list it, it's going to go out of your brain. But if I'm like, okay, you guys, like I gave digoxin and I didn't check the apical heart rate, and then this patient crashed because it was too low, or then you're going to remember that better, right? Like I didn't do that, by the way, but you know, we all do make mistakes, and it's nice if we can learn from each other's instead of having to like remake all the same mistakes. So that's cool.
Speaking of digoxin, in theory, okay, so in digoxin's kind of like, I've given it one time.
Yeah. So digoxin used to be given all the time. So in your elderly
population,
it's dangerous. Yeah, because we give it to people in heart failure, right? But people in heart failure also have imbalanced sodium, and sometimes, right, because they have a hard time with fluid balance. So if you give you're at higher risk for digoxin toxicity if you have imbalanced sodium. And so it's like because of the diagnosis you give digoxin for, you're at high risk for this potential thing that can make digoxin more toxic. and so it's more risky. So you'll see it more in your elderly patients. When I worked at the nursing home, so many people were on digoxin. So like if they've been prescribed it 30 years ago and it's working for them, most cardiologists aren't going to change it. But it's not being newly prescribed as a new drug nearly with as much as it used to be. So that's probably, even though you're seeing tons of cardiac patients, you're not seeing a lot of digoxin.
In theory, if someone's blood pressure is super low, can you still give them digoxin, and that's supposed to help with the heart contractility and their blood pressure will rise?
Yes.
Okay.
In theory, yes. You're
Okay.
much more concerned about the heart rate with
Okay.
digoxin than the blood pressure.
Okay.
Yeah.
Because I remember the one time I gave it, they were like, they may have been in the 80s over something, or it might have been the 90s over something,
Yeah.
but freaking messaged the hospitalist, and then I think they said don't give it, and then I saw the freaking cardiologist who prescribed it like walk by really fast, so then I just like snuck over to them at the nurse's station, and then was like, hey, do you mind if I ask you a question on one of your patients really fast? And I just told them, and they're like, oh no, give it.
Yeah.
So it was cool. The specialist cardiologist person was like, give it.
Yep.
And then the hospitalist, who was just kind of, it wasn't their patient, but they're the person that was
Right.
on for the night, they said to don't, but gave it, and actually their blood pressure did go up.
Yep, yeah. So that totally makes sense, and you'll
But
see this.
it was kind of, it's almost like you feel, it's,
Nervous?
I want to say their systolic was in the 80s,
Yeah.
so it is kind of...
Yeah, and you did exactly the right thing, right? It's like you questioned it, which I would definitely never just give it without having somebody who knows a lot more than me tell me that it's safe. And the hospitalist is naturally going to do the textbook answer, which is no, and then the cardiologist, like you said, is the one who truly knows that patient, knows their specific cardiac condition, what's going on with them, to know, okay, this is safe for them and actually it's going to help them not hurt them. So we do the same thing with beta blockers, right? So you, depending on if it's selective or non-selective, you may reduce the blood pressure, but mostly you're going to affect the heart rate. So it's like if the heart rate is 130 and the blood pressure is 92, do you want to give it? Like, you know, it's questionable, but you still might want to give it, even though it's a low blood pressure, especially if it's, you know, a selective one that's not really going to affect the blood pressure, because you strengthen that heart and you're going to get your blood pressure up. So
Digoxin's not a beta blocker, it's another category.
antidysrhythmic.
Okay.
Yeah,
Okay.
but it's the same kind of concept. It's
Gotcha.
like you're helping the heart, which will help the blood pressure if you can help the heart, but you just have to make sure you're not also vasodilating and lowering the blood pressure, right? But I think in general, we teach in nursing school, and I think it's a good thing to consider no matter what heart medication you're giving, you want to check the heart rate and the blood pressure, and if one of them is not normal, you need to question the order, whether or not it's prescribed for blood pressure or for heart rate control or for something totally different, right? Because like sometimes they give beta blockers for like anxiety and stuff, and so it's like you still need to question those things and then go to somebody who spent years in school to tell you if it's safe, because you can't carry all that knowledge or that burden of decision making, and you shouldn't have to.
Is sorry, a couple more questions about the doctorate thing. Is that the highest level of education? And not like well, there's like being a doctor, but a doctorate, is that
Yeah, so any degree, you have what they call a terminal degree. Any field, you have a terminal degree. And so for nursing, you can get a DNP, which is a Doctor of Nursing Practice, or you can get a PhD, which is basically the difference between it. They're both doctorates, they're both terminal degrees. A DNP is more practice focused, a PhD is more research focused, so it kind of depends what your long-term goals are. But those are both considered terminal degrees. In medicine, you get your MD, which is your, I'm blanking. It's basically your terminal degree, right? So you're a medical doctor. You can get, so no matter what field you're in, you can usually get a PhD, but then you can also get some other kind of terminal degree in certain fields. So that's what a DNP is in nursing practice. But you could always get a second, like a PhD, in addition, but it's the last degree. Like, there's no continued school past that. You could just like branch off and do a different similar type of degree.
Would you go for a PhD, or are you done with education?
No, I got my terminal degree. I'm done.
Okay.
Yeah. I mean,
Or
really,
is
there's
a
no
doctorate a PhD?
So a DNP is a doctorate, a PhD is a doctorate. They're both doctorate. They're both
Okay.
doctoral degrees.
Okay.
They're just like different focus.
Gotcha.
A focus on different things.
Okay.
So I got my DNP, my Doctor of Nursing Practice, because my focus is clinical and education. So it's a practice focused degree. If I wanted to go into research, or if I wanted to go into publishing or administration or something like that, then doing a research, like a PhD, I could go that direction. My heart says no. I don't have any interest in going into administration or into research or things like that. I mean, not in the form of like lab research and that kind of thing.
Yeah.
You know, like you can still do practical research, but so no, I do not think that I would do that.
What you're doing right now, you seem to really be into it.
Yeah,
You know what
I
I mean?
do. I enjoy it a lot.
And that's good. That's good. Like, you need to enjoy what you like doing.
Yeah.
You know what I mean? Like, you just can't show up to the job site and be like, like, whatever.
Totally.
You know? Like, you show up and you're freaking energized and you're always, like, smiling and stuff.
Well, yeah, this job is like all the things about nursing that are fun, you get to do all the time.
Yeah.
You know? Like, so, like, you're a nurse on the floor, and say a cool skill
That's
comes up,
crazy.
and you're like,
That's
this is
crazy.
cool, I gotta go do this cool skill. Well, that's what, when I go to clinical, that's what I do all day, because I jump from one student to the next doing the skills, like
Yeah.
doing the fun stuff. And then when it's like, nursing can be a very thankless job, right? Like, you do have patients that are kind and that thank you, but you also have patients that are very unkind to you. And you know, it's fine. Like, you just don't take it personally. It's fine. Like, you're not there to make friends. You're there to like help people. And so the mindset is different, right? But like in teaching, everyone's super nice to you. Because they kind of have to be, because you're grading them. But I pretend that they just want to be nice to me. But like, they're just always nice. Like, you just get, it's a very, like, even if you don't get thanks from areas in administration, you may or may not, but you always get gratitude from your students. Like, you know, even when people are struggling, it's like most of the time they don't blame you. They're not like, I don't get this because you stink. It's like, they're just like, I don't get this because it's really hard.
Yeah.
And it's like, yeah, man, it is really hard. But it's like, for the most part, I don't know, the students are just like, it's so cool seeing people like make breakthroughs in like understanding, and also just like kind of learn patient care, because we get students that have never taken care of a person, like never touched another person that they weren't in some kind of like relation with.
Yeah.
And so it's like really cool to see people learn and blossom and like love the world of nursing, even though, you know, you're not going to love it all the time, but it's cool.
I think you would be impressed, I think, with like my skills and knowledge have gotten exponentially better since
awesome.
like working with you as a student.
Yeah.
I mean, I work there full time, and like honestly, like I pick up a fair amount of overtime just because like you get paid actually, like when you're on the clock for overtime, it's like
it's really
it's
good.
Honestly life changing.
Yeah.
The overtime pay.
That's cool. And
but
you're young, like why not, right?
Yeah. Thank you. But I have my freaking like I feel decently organized, and I have everything like dialed in.
Nice.
Like,
you have your flow.
because you know kind of how I am with like processes and stuff, and like I get report, and then the first thing I do, I just go to the 4 patient rooms, just doing what you guys taught us, like, you know, instead of going to the monitor, check the patient first. So I just check everyone. My name goes on the board just so if you walk in, you know who to call, and you have the radios, right? And then I go do the telemetry strips just to see what everyone's heart rhythm's in. Mm-hmm. And then that goes on a sticky note, put it on my computer, and the sticky note's just freaking there. Yeah. So I know I just can look at the thing, and I was like, all right, this was the rhythm when I got here. And then I'll go over and I'll see who the doctors are on, and I won't even have a certain like doctor, but I'll just write down their name and phone number in case anyone needs it. And then the main hospitalist, I'll have their thing, and then that's another sticky note. And then I'll just freaking start doing like assessments on everybody. And then after all that's done, hopefully relatively quick, then start doing more like research, digging through the orders, and like usually it's like med pass time at that point.
That's cool.
But
so you're establishing
it's honestly
your care.
Cool. It's cool.
Yeah,
it's
and
cool.
then you're ready, like if something goes wrong, right? Like that's what you need to get those basics and like know who to call, because something could go wrong right then in the morning, and you don't want to be like somebody walks in and sees the patient, something's wrong, and they're like, who do I call? Who's the nurse? Da da da. So you're establishing like, I'm caring for this patient for the next 12 hours. Call me. I know who I need to call if I can't answer it. And that's really cool. That's awesome.
Last night was freaking not. I shouldn't say busy. So the group that I had last night was the easiest group I've had in the last like 6 nights, because I just did 6 days in a row. That's how it. I was on vacation for like 2.5 weeks, and then when I got back, I kind of had to do some all together. But everywhere else on the floor, there's like this code blue, and then someone went to the ICU, and then there was this other lady who, if they weren't on the high flow airvo, on room air, they were 30%, and their lips were blue.
Were they awake?
Was barely. So that was like its own little like soft rapid response. But then, her like
scary though.
Scary, but it was going up by the second.
That's
like once we got them back on the thing, and then they had to come closer to the nurse's station. And then there was this other lady. There was a bunch of oxygenation issues last night. There was this other lady way down the hall who was slightly confused, and she pulled off her BiPAP.
Oh, yeah.
And she, on room air, she was 70%, and like didn't want the BiPAP on and stuff.
Right. And then it's so hard when they get desaturated. They get more confused and more combative for it. And
so there was like 5 of us that had to really calm down the situation. The main nurse gave her Ativan, and then we got the BiPAP on, and just freaking, she wanted to like hold our hands and stuff.
I know, that must be so scary for her, right? Like she has this thing on her face, gets it off, and then she just gets worse, and then all these people are like hovering, and it's like, you're like, we're just here to help, but I'm sure it doesn't feel like it to her when she's like panicking.
They wanted to call their husband, and we're like, the respiratory therapist was like, don't like talk right now, just freaking focus on breathing. And then the last 5 minutes of the shift, there was a legit rapid response, because someone from the emergency room dropped off a patient. And I guess in the emergency room, the patient was fine. And I don't even know, how sometimes the ER nurse that drops off the patient isn't the primary nurse from the ER, it's just like a messenger. Maybe it was a situation like that, but the patient got there, and the nurse on telemetry was like, freaking, like, you guys can't wait 10 more minutes for the change of shift, so then I don't take report and then give report, like...
Right, the telephone game,
it was,
right?
Telephone game. But then this patient got here and was breathing with pretty much just their stomach, and their respirations were like 40, blood pressure 190 something over like 80, and then they were 70% on 15 liters, and then the house supervisor was, for some reason, was in the room, and then she's like, just call a rapid response.
Go right to the ICU. Oh no.
Or go back to the emergency room.
Yeah, get a little stabilized first. Oh gosh.
But that was last night, so maybe that's why I slept through my alarms. But I do apologize again for that, honestly.
No problem.
Like all last night I was freaking hyping up for this. I was like, oh my gosh, like freaking Darby's coming over, she's gonna let me interview her, and then like I wanted to like tell people I was working with last night, but I was like, no, because the thing is, if for some reason, if life happens and you're not able to make it today, then it's like I freaking told Audrey, you remember Audrey?
So, of course I
she
do.
Worked last night, and I was like, dude, like I should tell her.
You have an amazing team.
Oh, it's cool. It's cool.
It's really cool. I've done a couple covered some instructors over there, day shift, not night shift, but it's like, even on day shift, but on night shift, it was so fun seeing you guys. It's really cool. Yeah. But also, when you're saying, like, you feel like you really honed your practice and you're doing a lot better and all this, I don't ever think you were doing bad, by the way. So you were
Thank
doing
you.
great even
Thank you.
as a student.
I
But
appreciate it.
also, I know that you're going to be a person that will just continue to do better and better because you're a person that will push yourself, right? Like some people, when they feel like they're doing good enough, they'll stagnate and be like, that's good enough. But you like truly want to understand and learn. So I know that you have a natural sense of continuing your education, not necessarily in school, but just you're going to research the changes. You get a new diagnosis, you're going to try and understand it. You get a new med, you're going to try to understand it, right? That's just you. But what's cool about the hospital you're at and the unit you're at is that you see a lot of similar diagnosis patients. So you can really specialize your knowledge and specialize your practice to be able to give them the best level of care, which is why your hospital is really known for that, known for the cardiac care, because of the surgeons and the cardiologists that work there, but also because the nursing staff has also specialized their knowledge in everything. So it's like, I know you get a little bit of other diagnoses. You can get pneumonia, and you have septic people, and you have all these different things. But you have a really heavy cardiac focus.
Yeah.
Right? So it's like if somebody who has a severe cardiac disease goes and breaks their hip and goes to another hospital for an ortho surgery, those nurses aren't going to be able to manage their cardiac condition as well as you. Not because they're not as smart or anything like that, but it's just that's not what their focus is, and that's your focus day in and day out. Is like, yes, you do the other stuff, but the cardiac is like central, right? And so your practice is going to be so good and be able to be so focused on that type of patient, which is really cool.
And every shift I'm still learning a bunch, don't get me wrong. Like I still got a long way to go in terms of like learning stuff, but it is nice to whenever I have questions and stuff, I just run it by the shift lead or just go straight to the manager, and it's nice freaking stealing some of their knowledge and like
that's
honestly
right.
using it for my own good.
That's cool.
You know what I mean? Like it's
and I'm
funny.
sure that's what they want, right? Like
I hope so.
Everybody wants shared knowledge, you know? That's cool. That's really cool.
The other crazy thing that happened last night, get this, like this is I was like shook. Easter 2023, I ran into one of the people I was taking care of last night. I don't think they recognized me,
okay.
But I actually spent my favorite Easter ever with this patient. My car wasn't working. Easter 2023. It was on a Sunday. I needed a new alternator, so I'm in freaking AutoZone, and this guy behind me who's a diesel mechanic who I took care of last night. He's like, he's hearing me like talk to the cashier and stuff, and then because sometimes the people at AutoZone know a lot about cars.
Yeah, for sure.
And then he's like, oh dude, freaking, I'll pretty much replace it for free. Just give me like $100. And that like just freaking okay.
The guy behind you?
Yeah, the guy behind me, and I'm like, okay, cool. So then he sends me this address, pull up to his shop. It's like behind Food for Less and Slow or something. And it's like just the sun's out and I'm just sitting on the curb, and he's in my freaking engine for like 4 hours just like fixing it, telling me all about his life and like all about his like medical complications.
And this
just,
is
like,
on Easter Sunday?
Yeah, 2023. I'm pretty sure we had a test the next day. So like I wasn't planning on like doing anything crazy anyway.
Yeah.
I was honestly like, dude, like, am I gonna have a freaking car this week?
Yeah.
Because it literally like, it would turn on and then just the battery would drain.
Oh no.
And then like it was like a surreal experience, because most of the time on Easter everyone's always like stressed out about food and driving places and seeing their family and friends, understandable. But me and this guy were just chilling in a parking lot, sun's out, and he's just telling me about like his gnarly life that he lived and like how he's from Mexico and like moved here and like just like has to do dialysis and has to do X, Y, and Z, and like just freaking
Did you tell me you were in nursing school?
I did at the time, but I know last night, maybe deep down he recognized. I didn't want to be like.
Did you say anything to him?
No, I wanted to
on.
keep it chill, but everyone, the person I gave report to, I think they like wanted me to freaking say something, but and this guy's super freaking religious and was like trying to get me to go to like the church he goes to, and he had these water bottles. He's like, dude, like I don't drink tap water or anything. I have these water bottles that I fill up with a waterfall like over in South County. And then he's drinking it, and then he's like, here, freaking take some. So then I start drinking his waterfall water, and it's really freaking good. And he gives me a water bottle. I remember I brought it to school the next day and was like giving some to like Will and like Ariane and Audrey and stuff. And I walk in yesterday, and that was the freaking guy.
Wow.
Yeah, and it was just like a full circle thing.
That's cool.
And
yeah, man.
He's super chill, and I just remember like he's super religious, so you almost kind of like feel like you're like talking to God when you're like in his room and stuff. And I'm just crisscross applesauce, like listening. Like once I got caught up with everything, I was helping him do some stuff, and I was just sitting on the floor, like listening to, because he likes to like tell you like about like the things he's like going through and stuff, and he's just preaching like a big part of just like. Yeah, like I don't have friends, I just have family. Aww. Like saying like everybody that, because there's some person who freaking came in the hospital and visited him until 3 a.m. and was like rubbing his legs and giving him a back massage because he was in a lot of pain and stuff, and he was like, yeah, like these are my friends, these are my family and stuff. So it was crazy.
Yeah, well, and it's cool because he practices what he preaches, right? If like in 2023 he did this kindness for you as a stranger, and so he's talking, but you're like, you're not just talking a big game, like this is cyclic kindness, and how crazy that like then you're caring for him in this role. And it's just really cool. I mean, we live in the world is small, right? But the Central Coast is teeny tiny.
True.
And so that's super cool. That's really cool.
The waterfall part was that's funny. The funniest part.
That's very funny. Yeah, I mean, you're kind of brave. I don't know if I would drink his waterfall water.
That did go through my mind, but it's like...
You only live once.
Deep at heart, I am like a risk taker.
Yeah.
Like deep at heart, like I'm like, whatever, we're here,
Yeah,
but
cool.
That's just how I live, I guess,
No risk, no reward.
True, and it did taste good. It was, it felt very, like, clear.
Yeah, that's cool. Right on.
Okay, back over to you. What, you want to go for, like, 10, 15 more minutes?
Whatever you got,
Okay.
Sounds good.
So you currently... You're a teacher, you're a nursing instructor at Cuesta. You're relatively new-ish to being an instructor.
Oh, yeah.
You're like 2 or 3 years?
4 years. I just finished my 4th year.
Nice.
And then plus like a little bit from CNA, but.
And so you're getting some more time and experience under your belt,
Yeah.
Like.
Oh yeah, like hopefully the class that I'm teaching now, that was the class that I taught you, is way better than it was when I taught you.
It was good when you taught it, though.
That's the idea. Is hopefully it's like a little better every year,
your class was good. Like you taught us a bunch of there's freaking like patient complications. It seems like disease processes.
Yeah, we taught a lot of
rheumatoid arthritis, hemophilia. You had a bunch of GI stuff that we see all the time now. The freaking Crohn's disease, irritable bowel syndrome, what's that one thing called? Diverticulosis, diverticulitis. We
go through all that.
That was your class.
Yeah, we go upper GI, lower GI, liver, gallbladder, pancreas, vascular. We do sepsis, shock, MODS,
SIRS,
yep. Gosh, a little bit of everything.
Gout,
yep. And I used to do trauma, like some chest trauma. I don't do that anymore.
Burns.
But I do pulmonary. Yep, I do skin and burns, so skin cancers and diseases, burns, pulmonology. Basically, I do everything except for kidneys and heart and neuro. Because neuro goes to the other class.
Yeah.
And neuro and kidneys, I think, are a combined class. And then heart is 4th semester.
Neuro's hard.
Yeah, neuro's hard. But you know what? Neuro's hard for neurologists. Like,
is it?
Yeah, because neuro is so...
You can't
it's
see
probably
it.
The most unknown. Like, there's the most... It's still, like, the most... I don't know how to explain it. It's like, there's still not... It's not a perfect science yet. Like, the brain still has so much unknowns with it. Like, some of the structural... Like, even the heart is complex, but it's structural. And you can, like... There is electrical in there, but it's a lot of, like... muscular, structural, abnormalities that you can look at and be like, okay, this is very clear. But the brain isn't always as clear, right? Like, you can see plaques, you can see growths, you can see certain things or vascular changes, but then at the same time, there's so much unknown. It's cool.
Yeah. It's like you can see heart in the freaking tiny arteries and vessels and kind of see why something's not working, but I feel like you can't really see like a nerve.
Right.
You know?
Yeah. And the brain it's just crazy. Like, I don't know. I feel like we don't know a whole lot. And even the heart stuff is so new, like heart transplants and stuff. This is all like, first heart transplants was like in the 60s, I believe.
Are you serious?
Yeah. So not very long ago was our first heart transplant. And now we do them. I mean, I know we don't do them here, but like where I worked in Georgia, we did them all the time. And it was like, they're really successful. Not always, but so to think that our first one ever was in the 60s, and then here we are with patients who have hearts that are 25 years old and still going strong, it's like pretty amazing.
Does most of the people when I graduated, like, is like Rick still there, and Genevieve and like Monica and stuff?
Yeah, Rick and
Genevieve. I know Michaelin's there.
Yeah, Michaelin's there. Rick and Genevieve and Michaelin, and yeah.
Nice.
Not too much of a changing team yet, although we'll see what happens.
Really?
Yeah.
Because people retire and stuff, or like go places.
And there's new blood and changing, or they might go into like a different department, or, who knows. There's different opportunities. Sometimes they'll go into a different, like Hancock is close too, so, depending on where you live and whatever.
What, how many years do you have at bedside? Like bedside nursing?
Let's see. I would count, to answer your question, I would count my LVN, because, like, talk about bedside nursing. Yeah. That's, like, very bedside. So that was, like, 2012 till, so probably, like, full-time bedside, like, 9 years-ish, something like that.
Nice.
Yeah.
That's a good chunk of time.
Yeah, and then plus 2 years as a CNA, which I know is not nursing, but it's still like, you still learn a lot as
You're
a
still
CNA.
there, under the same roof.
You're still there. You're still like doing really hard work, time management, and all that kind of stuff.
What inspired you to be a teacher?
I don't know. I just love teaching. I mean, I had some great teachers, and it really made a big difference to me.
Yeah.
Like, my CNA teacher was amazing, and like I still remember stories she told me, and then, I think probably the most inspiring teachers are like the terrible ones, because they're the ones who are like inspire you to not be like that, right? Like you know what I mean?
Okay.
So like the good ones are like inspiring as far as aspirational, but like the ones that are like not good, and the other thing is like when you're teaching nursing, sometimes you just want to as a student, you just want to get through the class, right? And that's cool. But there's so much more that you have to learn about, like, being kind to patients and, like, not being judgmental and, like, not just pathophys, but, like, how to really check your implicit bias before you go in a room and, like, realize that everybody deserves kindness and everybody deserves good care. And so if you have a teacher who doesn't show that, then you're not prioritizing that for the students. Then, like, you're getting a generation of nurses that just feel like they have to know pathophys and not know kindness and not know to check themselves. And then you get the nurses that are talking badly about patients, talking very judgmentally about chronic pain, and then not addressing chronic pain because they have these biases, or any number of other things. But that's like an example. But it's interesting. I mean, it's like, I don't know if you remember if they talked about it even in your psych class, but these people, to me, it's like, at what point you think about a person's life, you have a patient who comes in and they're 4 years old, okay? And they come in with a broken leg, and you do an x-ray and you see multiple broken fractures throughout their body. They have multiple stages of bruising throughout their body. They're clearly being abused. And they're crying, and you have so much compassion for this poor child, right? And then 10 years later, they come in at 14, and now they're in foster care, and now they're like, their U-tox comes back positive for drugs. And you may be like, oh man, this sucks. Like, they're 14 years old. They have an STD. They were molested, whatever. And you have so much compassion for this person. 10 years later, they come in at 24. They're addicted to pain medication. They're, a sex worker or something. And they're giving you attitude, and they're mean, and they're this and they're that. And you're like, screw this person. I don't want to give them kindness. Well, think about what they've had to go through to get to this point. They're not innately a bad person or a mean person, but it's like you lose all your compassion. Like, at what age do you stop caring about them or stop seeing them as a person? Like, at what point does their response to all their trauma become so inconvenient for you that you can't care about them anymore? You know what I mean? Does that make sense?
Yeah.
And so it's like, or is it 10 years later at 34, then they're a deadbeat, then they're just a drug seeker, then they're what? But no, like, their pain is real. Not all pain is physical. Like, so I think there's a lot of implicit bias that needs to be talked about in nursing school, that you can't walk into a room and look at a patient or hear what another nurse says about a patient and just think that they are like a waste of a person, because at some point they were a kid and they were, they've been through all this. And so I think that in teaching, you need to remind people that if you want to be in this business, you have to be able to check yourself and not fall into that pattern of just like, and I'm sure you see it, right? Like this pattern of nursing being like, ugh, this patient, right?
Yeah.
Because they're important.
Yeah.
Anyway.
No, you're good. Keep talking.
I don't know what to say else. That's like a big thing for me and we all struggle with it, right? Like when somebody talks to you like garbage, it's hard not to feel a little bit negative about them. But I think just to remind yourself that like the percentage, like, so this is what I was saying in your mental health class, the percentage of people who become abusers were abused, right? Or the percentage of drug addicts were at some point exposed to severe childhood trauma. And so you see them as a drug addict instead of as like a person that has been hurt that really just needs compassion, right? And so it's like, what decade do you stop caring about a person? What decade do they not matter anymore? Like, how much trauma do they have to go through for none of their trauma to matter? So
well said. Yeah. Well said. No, I agree with you.
I don't know if that makes sense, but
no, 1000%. Yeah. I mean, I mean, like, you just see people and they're people with souls.
Yeah.
And you gotta be nice to them.
Yeah.
And honestly, like, you gotta say, like, it is nice to say some kind stuff to them, and freaking like if you don't think you could make an impact on someone being like a stranger, saying like a couple sentences, like that's like so false, because honestly some of my favorite things that have ever been said to me were freaking by strangers.
Yeah, isn't that interesting? Totally.
Literally this homeless person told me like keep the responsibilities of an adult but the heart of a child. Aww. And I was like, damn, like I'm holding on to this forever.
Cool.
Yeah.
That's really cool.
It's I mean, like, nursing is it is customer service.
It is. It really is. Yep.
You got to be nice. You got to be nice to the freaking customers and be have that working relationship and make sure you're not getting like too pushed around and have like
right. You have to also be able to do boundaries, right? Like, but, I'm not saying be a pushover.
But be professional and freaking listen and do the right thing.
Yeah, totally. Yeah. I guess like at the end of the day, you might not have the energy or the compassion, because compassion fatigue is super real, especially in nursing, right? To like give a lot of yourself, and that's okay, because you ultimately have to protect yourself.
Yeah.
But if you don't have anything nice to say, don't say anything at all. Yeah. I think like at the end of the day, that's what it is, right? Like, don't be unkind. Like, if you can't be kind, just don't be unkind.
Yeah. Last couple of questions.
Okay.
How do you when you're when you go into teaching a lesson plan for the next day, how do you prepare to teach that lesson?
Oh gosh, too much.
Really?
Yeah, I
Okay.
prepare a lot. And I think maybe...
Or do you just walk in, freaking
No.
slam a cup of coffee and be like, okay, I remember that from last year.
I wish I could do that. I don't... I want to be as prepared as possible, you know?
Okay.
And so... But I will say, like, it's less than... Like, every year that I teach, it's a little bit easier. But I also, like... Every lesson, I want to, like, look up and see if there's been any big changes of practice, right? Although a lot of times, like, the students will come to me, which I really appreciate, after class and be like, oh, hey, I just read about this new article that this is changing. So a lot of times they'll bring stuff to me that I didn't catch, like, in my preparation. But so I do watch a lot of YouTube videos because I feel like, and a lot of nursing student YouTube videos, because that helps me know what level to teach to. Because, like, in the beginning, and I think even sometimes I get really into it, and so I teach too deep. Like, at a level you don't need to know as a nursing student. It's just that, like, I'm a pathophys nerd, so I think it's really cool when you, like, get down to, like, the nitty-gritty of stuff. But it's, like, a waste of energy and brain cells for, like, most students. And so I think, like, I watch the YouTube videos to say, like, okay, don't go deeper than this. Like, this is all that's needed for the NCLEX. And, like, if a student particularly likes the subject, then they can, like, dig more if they want to. So I do that more to, like, understand the level of what I should be teaching at. And then I try to look up all of any kind of, like, changes in health care that have happened since that lecture relating to whatever topic it is, like liver or whatever. And then I always, like, re-look at my tests and compare my slides to my tests and see if I want to change any test questions, which I always do from, like, the previous year. And then I want to make sure that I, like, touch on those subjects in the lecture, because I don't want anybody to get to my test and be like, we didn't even talk about this, right?
Yeah.
And so maybe not word for word, but at least, like the information's been presented. I try. Those are, like, the main focus points. But it seems like that shouldn't take that long, but it takes a long time. Because, you know, those videos that I watch are probably, like, at least half hour each. And then you're doing a couple different ones. And it's like, I teach on, like, liver, right? My liver lecture. But it's, like, in that, I teach, like, cirrhosis, hepatitis, other liver diseases, storage of things, and I also teach stuff with anticoags. And so it's like, you can't just watch one video to, like, cover those areas. So I don't watch the videos for everything, but, like, I might watch, like, a cirrhosis video to say, like, okay, how deep am I going on cirrhosis? Because that can get really hardcore, right? And so it's like, so I'll do that.
It's knowledge is power.
Yeah.
Do you know what, the ESBL bacteria? I think that's what it's, extended spectrum beta lactamase. And it produces, the only reason I just did some research in the hospital, it produces this one, the ESBL produces this type of bacteria, Klebsiella pneumoniae. And the antibiotics this patient was getting was only killing one of the strands of the Klebsiella. So then once they did the test in microbiology lab or whatever, they were able to switch the antibiotics to a stronger one. I shouldn't say stronger, different one.
But it was more a susceptible one.
Yeah, exactly. And I forgot what it was, like, Avactum / something I've never given before.
Oh, interesting.
And that, switching it to that antibiotic, that is the green light, and that antibiotic will kill the bacteria that was causing the bacteremia.
Yeah. It's really cool. Well, that's why we have to get those cultures, right? And, like, don't let them leave the hospital before they get those cultures. And if they do, you better be able to get a hold of them to change the antibiotic if you need to.
Who freaking knew, though, that a bacteria could produce some sort of enzyme that destroys the beta-lactam spectrum antibiotics?
It's way over my head. It's amazing. It's amazing. I know. Everybody has their specialty. It's like, it's nice because nobody could do all that. Nobody can know all that kind of stuff, right? And, like, I think students beat themselves up because they can't know everything. And it's like, gosh, guys, like, everybody has their specialty. But it is wild that they can, like, actually do all of that and see all these crazy little things and stuff. It's cool.
What do you do in the rest of summer? Like, what are you looking forward to? And like, what's next for you? You were talking about you just set up kind of like a shop.
Oh yeah,
like,
yeah.
Tell us about that.
Yeah, so just like totally a little non-nursing thing. It's good to have like non-nursing stuff, right? Like, so I mean, I like going to the gym and like going hiking and hanging with the girls is obviously like the best. But so that's what I'll do is, you know, family stuff. But I started a little space in a shop. So I've done like pop-up vintage fairs and stuff. And so with one of my friends, and so we have like a little spot now at a antique store, and might be getting another spot at a different antique store, and it's super fun. It's just something so different. There's still like customer service involved with it, right?
Yeah.
But it's like just not at all nursing, which is cool too. Like it's just cool to, but I really like vintage things and antique, and just like the quality and the uniqueness of items and the stories that, like, you look, I don't know, like you look in an antique mirror and imagine all the faces that have looked in that antique mirror, as opposed to a mirror you go and buy at the store or whatever. So I don't know, there's a lot of, and all the little figurines, and just like, I don't know, there's just so much cool stuff.
Where do you acquire it?
Oh, so that's the other thing, like, that's super
you...
fun. Yeah, I take the girls, so me and the girls go, like, garage sales, estate sales. Yeah.
Nice.
And they have an awesome time. They call it treasure hunting, because they always, like, find a little treasure, and it's, like, it's super fun. And they know now, because we do it pretty frequently, and they, like, always ask to do it, and I'm like, we can only kind of do it on, like, the weekend. Like, you can't really do it all the time. But they love to do it, and I think it teaches a really important lesson for them too about, you know, waste in the world, and just trying to like reuse what you have. And then even them, they like, well, when they're done with their toy, like Lila the other day, or I guess it was a couple months ago, but she had a garage sale. It was like a kid's garage sale. We like wrote chalk on the driveway, 25 cents, 50 cents, and she put her toys out there, and people came and she sold her stuff, and then she got money to like take to the sales when we go and spend. So it's like teaches good lessons with that, but also just like, I don't know, there's just so much waste and so much trash, and so much like, even with clothes and like different polyesters and stuff that don't like, they don't decompose, right? Like, so we're making this huge amount of waste in the landfills, and I don't know, every little bit helps, right? Like to reduce waste, and I think the mindset of like thrifting and that kind of thing has become much more popular now. So like when I was a kid, it's like, oh, you got that shirt at a thrift store, you must, like, sucks for you, you must be so poor. And now it's like trendy, you know, like to do that kind of thing. And so it's cool. I don't really go to thrift stores. I feel like there's a lot of like, I'd rather go to places where the stuff's gonna like go straight to the trash. So sometimes I'll go to like the Goodwill bins, because it goes straight from there to the trash, because then I feel like it really is like putting something back into production or back into use that otherwise would be thrown away. But yeah, I don't know, it's really fun.
So earthy of you.
Yeah, that's my earth conscious contribution.
Do you have a bunch of like, have you been hoarding up a bunch of like items in your garage and stuff?
Yeah, so
like you're running out of space to like park now?
Yeah, well, that would happen if I didn't have a husband who has made me, so I have like a small storage unit, because you
gotta go get a storage unit?
Yeah.
Gnarly.
Yeah, but I mean, it's cool. It all pays for itself, because like we were doing the pop-ups, so we were like selling stuff, and I got like a really small storage unit. But I think my husband's like, yeah, you can't like bring this stuff to this house. Like, oh, I mean, I have the stuff that like I'm using, but like the stuff that's just sitting there, no, didn't really work out. So it's in a storage unit now, which it works really good.
That's funny.
Yeah.
That's funny.
Yeah. And now I'm glad I have it, now that we have the little shop, and might get another spot, because it's cool to have like a space that I can like go to that's kind of like separate from home and organize and stuff like that.
I imagine you bringing home like these like dirty blankets with like holes all in them and stuff, and you're like, I kind of want to keep this one.
I know. Yeah, I do. I keep probably more than I need to, but like a lot of it is like has like little imperfections, this or that, and I'll like fix things, or like, you know, shine things up or whatever. And it's like, it's so crazy, because some stuff is like, oh, this is garbage, and then I'll like fix it up, and then it's like, oh, it's actually so cool. It's like, yeah, it's really fun. It's very satisfying. I'm like a very artistic person that's terrible at arts art, and so it's like it scratches the itch.
Yeah.
Without having to actually be good at making art.
Heck yeah.
Yeah.
Anything, any last thing you want to say to anybody listening to this?
I don't know. No.
Okay.
If you want to be a nurse, be a nurse, and if you don't, then don't do it. Because it is like a degree you can get pretty quickly and graduate and make really good money, right? Like for a low cost of education, because you can do it at a community college. So I think once in a while somebody will be like, oh, okay, like in 2 to 4 years I can get a degree, graduate, make $80,000 to $90,000, especially if I want to do some overtime. Like, I'll do that with virtually no debt. But if you don't have a heart for it, you're going to burn out, and it's just not fair to you, and it's just not fair to any other patients either. So.
Yeah.
But
yeah.
Otherwise,
really.
It's cool. And you could always do nursing assistant, and then you'll know, right?
Yeah.
Because then you'll know if it's for you or not. But yeah.
Thank you, Darby. I appreciate
Thanks,
it,
Lucas.
honestly. Thank you.
Yeah,
Thank
no
you.
problem.
Like,
My
honestly,
pleasure.
like, I'm stoked you came out. I'm stoked you gave me the opportunity.
Of course. That was fun.
I've been meaning to like text you and try and get this set up for a while now.
Yeah.